My name is Abdulrazak Abyad. I'm from Lebanon, based in Tripoli currently. I'm the CEO of Abyad Medical Center and chairman of the East Academy for Medicine of Aging and president of the East and North Africa Association on Aging. We were talking about some of the lessons learned probably during vulnerability of demented patients during crisis, and we're talking about that they cannot escape due to lack of mobility or physical strength, worsening of pre-existing marginalization and exclusion, invisibility to humanitarian actors, inability to leave home. In addition, families and communities usually disintegrate and may be separated. They are less able to adapt to demented patient. They have difficulty in securing their basic needs, and medication and health facilities may be inaccessible. So it's a big challenge. Dementia management provides a huge challenge for us to manage. The challenge is for demented patients to be seen, heard, and understood, to have equal access to essential support services, and to have their potential and contribution recognized. Elderly patients, especially demented, they are overwhelmed by distress. They have constant feeling of despair and powerless, and they have no pension, and many people simply starve. And their voices are not heard because, during crisis, the voices of young children are heard more, as this picture depicted from Syria, the young child that died during trying to escape from the Syrian conflict. So elderly are left, especially demented patients, are left alone with no one to turn to be seen and to be heard and understood is difficult. The healthcare sector, breakdown of infrastructure, health system constraint, there are shortage of medication and medical supply, and shortage of health and other personnel. There are a lot of impact, psychological impact that affect demented patients during civil unrest, during disasters, and the level of anxiety and distress increased markedly. Again, during humanitarian crisis, older people are vulnerable to poor nutrition. Mainly, they cannot access food. They have difficulty reaching the food distribution point or market. They have inappropriate food. There is lack of warm clothes and malnutrition and unchecked and untreated. What are the solutions that we learn and that we suggest for to deal with demented patients during it's important to have a close collaboration between humanitarian agencies and dementia specialists. Especially, humanitarian agencies may not know or aware of the conditions, and therefore the specialists need to direct humanitarian aid toward those elderly patients that are staying at their home and are unable to leave and reach services. We need, therefore, to establish outreach care and home visiting program, which we did in Lebanon, and we need to develop systems that prioritize or protect the most vulnerable elderly. We need to ensure that drugs are available for the elderly. We need to raise awareness of the impact of grief and trauma on demented patients, and develop psychological and psychosocial programs that involve and support older people. As far as nutrition, we need to provide food that is digestible by older people and especially demented patients. Food should be familiar and culturally accepted as well. Malnourished elderly people should be taken care of, and we should ensure that food for work programs do not exclude older people from food provision. We have to bear this 10 points in mind when we are dealing with disaster and with demented patients. First, we should ensure accessibility of the elderly patient to services. We need to use fully inclusive framework and standard of care for our elderly patients. We need to create dementia awareness among people taking care of the crisis and among public as well. We need to collect data and know where are our demented patients, where they are stationed. And we need as well to widen the evidence-based approach of intervening in disasters. We need to foster collaboration between different NGOs, the government, and professionals. We need to monitor inclusion of our elderly patients in the humanitarian services. We need to have inclusive humanitarian action we need to encourage and to have more dementia-focused NGOs. And of course, we should not forget the fact that we need to train people more in the field of aging and dementia. And this is our conclusion. It's very important to be seen and heard and understood. Demented patients in disaster and crisis, they usually are left alone, and this is the biggest problem that they will face.